Welcome back to What the Study Says. All right, let's get right into it. There's a brand new major 2025 review out from the medical journal JAMA. And wow, does it ask a big question. Does the science on medical cannabis actually match up with all the hype? You know, we see dispensaries everywhere promising relief for just about everything. But what does the hard evidence actually say? Let's find out.
So let's kick things off with a huge number just to set the stage. According to this study, a staggering 27%, yeah, that's more than 1 in 4 adults in the US and Canada, have used cannabis for medical reasons. This is not some little niche thing anymore. It's totally mainstream. But what are they using it for exactly?
Well, here are the top 3 reasons, and they are things a lot of us deal with. Over half of people are using it for pain and for anxiety, and almost half are trying to get a better night's sleep. I mean, when you look at a list like that, you can totally see why cannabis has this reputation as a kind of wonder drug for all our modern problems. But, that's what people hope it does. So let's shift gears and look at what the science has actually proven through really tough clinical trials, what has actually passed the test for official FDA approval. I think the answer is going to surprise you.
Okay, check this out. The list is really short and super specific. We're talking about pharmaceutical-grade cannabinoids for things like severe nausea from chemo or appetite loss from HIV/AIDS. And then there's a specific CBD solution for some very rare and severe seizure disorders in kids. Now, what do you not see on this list? Right, the big 3: pain, anxiety, and insomnia. And that right there brings us to this massive disconnect. So let's dive into that gap between why millions of people are using cannabis and what it's actually been proven to do. It's time for a little reality check on the most popular claims. Let's start with the big one, the number 1 reason people use it: pain. Millions of people are hoping it can help them manage chronic pain. It's really the foundation of the whole medical cannabis movement. So, what does the evidence really show? So this is a quote cited in this study, and it's from the world's top group for pain science. And they don't just say, maybe not, they explicitly recommend against using it as a first-line treatment. Why? Because the evidence of it helping is pretty limited, and the risks are well known. The big takeaway here is that the world's top pain experts are basically saying, hey, look somewhere else first. Okay, so what about sleep? Almost half of medical users are really just hoping for a good night's rest. And you'd think, intuitively, that it might help you relax and drift off, right? But do the world's sleep experts agree? And there's the answer. The World Sleep Society also recommends against it because there's just not enough evidence. So again, this isn't a "we're not sure." It's a pretty clear no from the leading authorities on this. They're saying the data just isn't there to back it up as a sleep aid. And finally, let's hit anxiety, another one of the top reasons people turn to cannabis. I mean, with so many of us feeling stressed out, it's no wonder we're looking for solutions. So what do the psychiatric guidelines have to say about this? Okay, this one might be the most powerful recommendation of them all. The American Psychiatric Association says to avoid it for any psychiatric disorder. And the JAMA study goes even further, warning that for some people, cannabis could actually make mental illness worse or even trigger it. And that is a really serious warning. So far, we've seen there's a huge lack of evidence for the most common uses. But the story doesn't stop there. It's not just about it not working as advertised. The JAMA study points out some significant risks that you almost never hear about in all that marketing.
This chart shows one of the biggest concerns. We're talking about high-potency cannabis, which the study says is anything with over 10% THC, and that's like almost everything in dispensaries today. Well, using it is linked to a much higher risk of psychosis. You can see right there on the chart, the risk nearly doubles compared to lower potency stuff.
And then you see this number, and it's honestly pretty shocking. According to the research, nearly 1 in 3 people, 29%, who use cannabis for medical reasons, end up developing what's called cannabis use disorder. And that's a clinical diagnosis. It means their use has become a real problem, causing significant issues in their daily lives.
And the list of risks keeps going. The study points to data linking daily use to a higher risk of heart attack and stroke. If you inhale it, it's linked to chronic bronchitis. And of course, there are the well-known effects on your coordination and judgment, plus the potential for some negative long-term effects on your brain. Okay, so the evidence for the benefits seems weak, and the risks are definitely real. But let's be realistic. People are going to continue to use it. So if someone does make that choice, the study actually provides some really clear evidence-based ways to reduce the potential for harm. Let's see what those are.
Think of this as a practical toolkit for safety. The advice is really straightforward. Go for products with less than 10% THC, start with the lowest possible dose, and go slow. To protect your lungs, choose edibles instead of smoking or vaping. Never, ever mix it with alcohol, and this one is so important. Wait at least 6 to 8 hours after using it before you even think about driving. If you follow these steps, you can seriously lower the risks.
So, after going through all the data, what is the big takeaway? Well, this quote from the study's conclusion really says it all. For most of the reasons people are using cannabis, the scientific evidence just isn't there to back it up. The hype has run way, way ahead of the actual health data. And that leaves us with this final, really critical question. We're living in a time where cannabis is being legalized and sold at an incredible pace, but at the same time, the science is throwing up some major red flags. So, how do we as a society start to close this dangerous gap between the marketing hype and the medical reality? And that's all for this deep dive. Thanks so much for watching What the Study Says. If you found this breakdown helpful, please be sure to subscribe and maybe share this with someone who needs to see it. We'll see you next time.